This is Melanie Matthews from the Healthcare Intelligence Network, bringing you healthcare industry performance benchmarks. The second annual Healthcare Case Management e-survey conducted by the Healthcare Intelligence Network captured the details of contemporary case management and the evolving responsibilities of today's case manager. The January 2011 survey found that not only are more organizations utilizing case managers, but the practice of embedding case managers at the point of care is becoming the norm. For example, the number of case managers working in hospital admissions office doubled from 2010 to 2011. And embedded case managers in hospital emergency rooms are fast becoming a critical element in a hospital's case management program. The embedded case manager is the first line of defense in determining medical necessity and can be instrumental in reducing the number of claims denials for a hospital stay, says Tony Sesta, Senior Vice President of Operational Efficiency and Capacity Management at Lutheran Medical Center.
Each hospital should take a look at a couple of things. One would be the diagnoses that you're seeing mainly being affected by medical necessity denials. Using your ED case manager as your first line of defense and looking at those soft admissions that may be resulting in admission denials will help you with your RAC audits, number one, and also should reduce your number of 1- and 2-day short stay patients, which are also vulnerable for RAC auditing. In addition to that, I would look just generally at nursing home patients, because many times if we intervene on those patients, we can prevent an inappropriate admission. I would also target anyone who had been in the hospital within the last 30 days. And each hospital should also look at how their state is looking at readmissions. So, for example, I'm in the state of New York, and New York State is looking at readmissions within 14 days. So in our case management software program, we're flagging patients who are admitted within 14 or 30 days, depending on their payer source.
The contemporary case manager's job description is also much more likely to include home visits, crisis management, and quality improvement duties in 2011 than it did just a year ago. In other survey highlights, more than half of the respondents said that cardiovascular disease was still the primary diagnosis for which case management was most effective. However, case management for initial mental health diagnosis was significantly less effective in 2011 than it was in 2010. This is Melanie Matthews for the Healthcare Intelligence Network.
For more survey results or a list of resources on this topic, please call the Healthcare Intelligence Network toll-free at 888-446-3530 or visit us at store.hin.com.